Over the past decade, there has been as high as a 4,000% increase in children being referred to so-called gender clinics across the United States. I was one of these children. My name is Chloe Cole, and I am an 18-year-old former transgender child. I transitioned from the age of 12 up until 16 when I realized it all was a lie. How did we get to the point where nearly every pediatric institution in the country considers it best practice to remove the healthy breast tissue of children while administering drugs typically used to chemically castrate high-risk sex offenders?
Do you want to know what's behind the transgender brainwashing movement that's destroying America? It's a coordinated effort starting in our schools, pushed by psychiatrists, politicians, big pharma, mainstream media, and doctors. They're planting seeds of doubt, making parents question their kids' natural development. Once convinced, doctors start prescribing hormone and puberty blockers to these defenseless patients. Woke Dr. Johanna Olson Kennedy refused to publish a National Institute of Health $10 million trans kids study that showed puberty blockers didn't help mental health of children. These puberty blockers belong to a class of drugs called GnRH agonists, which permanently block hormone production in the body. And folks, GnRH agonists are among the most harmful drugs on the market. Lupron is the most frequently cited one in transgender care due to its long history and availability. But Lupron allegedly causes permanent and crippling side effects, including severe bone loss, pain, soft tissue damage, hormonal disruption, sexual dysfunction, psychiatric issues, cognitive impairment, cancer risks, and cardiovascular and gastrointestinal disorders. The use of GnRH agonists in transgender children stems from an unproven theory that blocking puberty leads to a more satisfying gender transition in adulthood. But the groups authoring these medical guidelines admit they have no idea what they're doing and know there are serious safety issues with the drugs. A 2009 study of 19,271 men using Lupron actually increased the death rate, showing higher risks of cardiovascular events and mortality. Studies reveal high suicide attempt rates among transgender adults, between 40% to 42%, compared to under 4.6% suicide rates for the general population. What's shocking is that 81% of trans adults have considered suicide.
Because people are being lied to when they're being diagnosed. They're not being diagnosed with what actually causes the gender dysphoria. They're just being diagnosed with a symptom of a problem. And there are multiple problems that cause those symptoms. And when you don't appropriately diagnose people, you lead them into a life of ruin. All of these interventions are permanent, they're irreversible, and they lied to me.
These drugs are typically administered via injection every 1, 3, or 6 months to people that want to transition to another gender, suppressing estrogen and testosterone by desensitizing the pituitary gland. Then comes gender reassignment surgery, procedures like top surgery, chest reconstruction, bottom surgery, genital reconstruction like vaginoplasty or phalloplasty, facial feminization, and more. Some people call these body mutilation factories that destroy thousands of lives annually. Body mutilation is the intentional, permanent alteration of the human body. While these centers don't disclose per-procedure profits, the U.S. sex reassignment surgery market was valued at $2.1 billion in 2022, projected to grow at 11.25% by 2030, driven by demand and insurance coverage. Some ask, are we addressing mental health or creating deeper trauma through untested treatments? Dr. Paul McHugh, former senior psychiatrist at Johns Hopkins Hospital, stated that transgender people have a mental disorder that needs to be treated. He indicated that sex reassignment surgery is biologically impossible, and that people who promote sex reassignment surgery are cooperating with and promoting a mental disorder. As of September 14th, 2025, 25 states have enacted laws or policies banning or severely restricting puberty blockers for transgender minors under 18. Some up to 19. These bans make it illegal for providers to prescribe them, with penalties like fines or license revocation. But in other states, the network of gender reassignment surgeons, or what some call patient butchering centers, thrives. The top 5 in the United States include Mount Sinai Center for Transgender Medicine and Surgery, New York, performs 800 to 861 procedures annually. NYU Langone Health, New York, approximately 800 procedures. Crane Center for Transgender Surgery, San Francisco, Austin, Boulder, 350 to 500 procedures annually since 2012. Johns Hopkins Center, Baltimore, 300 to 400 procedures since 2016. Cleveland Clinic, Ohio, 250 to 350 procedures annually. Faith leaders view gender-affirming surgery or transitioning as contrary to God's design, asserting that biological sex is immutable and divinely ordained.
There can be no middle way in dealing with transgenderism. It is all or nothing. If transgenderism is true, if men really can become women, then it's true for everybody of all ages. If transgenderism is false, as it is, if men really can't become women, as they cannot, then it's false for everybody too. And if it's false, then we should not indulge it, especially since that indulgence requires taking away the rights and customs of so many people. If it is false, then for the good of society, and especially for the good of the poor people who have fallen prey to this confusion, transgenderism must be eradicated from public life entirely. The whole preposterous ideology at every level.
Some conservatives see a woman transitioning to a man as rejecting God's created order. Some ask, are we honoring the Creator or rewriting His design? This is bigger than one issue. It's about children, truth, and the future of our nation. Who benefits? Who pays the price? And where do we draw the line? If you made it this far, you're not here for headlines. You're here for what they're not telling you. Subscribe now, because next time we go deeper, and truth has fangs.